Okay, so I'm Dr. Hastings. I am an assistant clinical professor at the University of Minnesota in the outreach division. So I oversee fourth-year students in their rotations at community clinics. I've also been working, I've worked at many different private practices at FQHCs. I was a dental director of an FQHC in Portland, Maine. So that's kind of my background and interest. And I'll explain a little. I also work for a couple of teledentistry companies, so that's why I have this information to give you today. I also just want to say off the top, I know we've had a tough week and weekend here in Minneapolis where I live, and I know all over the country, so I hope everyone's doing okay. I'm glad we can come together over the next hour and discuss how we can all do our part in our field to continue to serve our communities and the health and well-being of our patients. So today I'm going to discuss teledentistry and is it right for our office and in the future, today and in the future. I also want to make a note that this, if you are in my network, this is the same presentation I gave at the University of Minnesota Continuing Ed Clinical Grand Rounds. This is a repeat, so if you don't want to listen, I'm not offended. And then, as Nancy mentioned, if you came on a couple minutes late, on the MOHC website, I do have a handout that goes along with this PowerPoint. And as requested, I will make a PDF of my slides as well. But my presentation is a distillation of the sources that I have on that handout. I just wanted to give you something to reference because this is a pretty information-dense PowerPoint. And then as we go, please go ahead and put question and answers in that chat box, and I'll answer all the questions at the end. For time's sake, this is about an hour presentation. And then some disclosures. As I mentioned, I am a contracted provider with a couple teledentistry companies. The first one is Oral Eye, or it's also known as the Toothpick app. I've been with them since 2017. I'm also a contracted provider with the Teledentists, and I have been since 2019. Neither company is paying me to talk about them at all. I only provide direct patient care as needed. And then I also want to note the regulations surrounding teledentistry are changing rapidly. I created this PowerPoint about a month ago, and last week I fact-checked to make sure everything was still up to date. I made a couple changes, but this is such a fluid topic, so by the time this is recorded, if you're watching it then, things may have changed. So our learning objectives today: what is teledentistry and how is it categorized? How is it currently being used in the United States? How can you implement teledentistry in the short term amidst the pandemic, which includes how to bill insurance, necessary documentation for reimbursement, informed consent needed, the current legislation surrounding teledentistry, and what systems currently exist to help dentists or other allied professionals get up and running. And also how teledentistry may continue in the long term and become more of a norm in dentistry. Telehealth is performed and allowed by these specialties. This is from the Minnesota Department of Human Services, so this is Minnesota in particular. But we as dental professionals are under the umbrella of telehealth or telemedicine. And some other telehealth examples that you may be familiar with are Doctor on Demand, Virtuel, MD Live. I've used a couple of those myself. I'm sure you're even more familiar as it's been all over the news that a lot of doctors are opening up their practices to telemedicine. Teledentistry, according to the ADA, is defined as the means for a patient to receive services when the patient is in one physical location and the dentist or other oral health practitioner overseeing the delivery of those services is in another location. This mode of patient care makes use of telecommunication technologies to convey health information and facilitate the delivery of dental services without the physical constraints of a brick and mortar dental office. The concept of teledentistry isn't new. The first documented use of teledentistry was in 1994 by the military. They did a supervised suture removal via intraoral photos. They surveyed the patients afterwards, and 14 out of 15 of them were happy with the services, mostly because there was no need to travel back and forth, but the doctors also reported that no post-op was necessary. And the Department of Defense also created the Total Dental Access Project, which connected specialists and dentists via telemedicine. And telemedicine itself has actually been documented back to the 1950s and 60s. So teledentistry is a little behind, but actually not as new as we might think. And like I said, it's not new, it more so has just reached its tipping point lately. So this was an interesting look at how many Google search hits there have been from March of 2017 to the start of this pandemic on teledentistry. There's definitely been a spike in interest, and I imagine that even since March, this has continued to increase and will continue to increase. According to the ADA, there are 4 modalities of teledentistry: synchronous, which is live video; asynchronous, which is a store and forward method; remote patient monitoring; and mobile health. And I'll go through examples of all 4 of these. So synchronous is the live video, two-way interaction between a patient, caregiver, or provider, and a provider using audio-visual telecommunications technology. So what we're doing right now would be considered synchronous. Asynchronous is the store and forward. So it's the transmission of recorded health information such as x-rays, photos, video, digital impressions through a secure electronic communication system to a practitioner, who then uses that information to evaluate a patient's condition or render a service outside of a real-time or live interaction. So this is not a new concept, as we in dental offices often send digital impressions to lab techs, or will send information to specialists like x-rays. Those are not considered billable teledentistry, but it is still technically teledentistry. The store and forward represented here on this slide is showing an allied dental professional at another site, maybe a satellite or a mobile location. They're gathering data like perio charting, dental charting, intraoral photos, x-rays. They're sending it via an electronic dental record system to a dentist, who then assesses that information, makes a diagnosis, creates a treatment plan, or maybe just determines the next step. And that could be the same day, or it could be another day later that week. Remote patient monitoring is the personal health and medical data collection from an individual in one location via electronic communication technologies, which is then transmitted to a provider, sometimes via a data processing service, in a location for use in the care and related support of care. So this is considered a subcategory of synchronous or asynchronous delivery, so it doesn't have its own CDT code. You may be familiar with this if you're in an office that offers oral sleep appliances or does screenings for OSA. So something like the at-home sleep apnea test, it monitors your heart rate, blood oxygen level, airflow, breathing patterns, and that information is sent via this device back to the provider. Another example of that is the Holter monitor, which is an at-home heart monitoring device used in medicine. Mobile health is similar. It's healthcare and public health practice education supported by mobile communication devices such as cell phones or tablets. This is also considered a subcategory of synchronous or asynchronous, so that it, again, does not have its own CDT code. An example of this is the company PH2O. So they say on their website, all you have to do is take a picture of your litmus paper strip, which the patients can buy from the company. They take a picture of that strip, the app does the work for you, it sends it to the dental office, so then the dental team can educate patients and assist in preventive treatment planning, properly selecting dental materials in order to initiate changes in the patient's oral hygiene based on the pH of their saliva. Another example of this, I actually saw this in the Apple Store a couple of years ago and it piqued my interest. It's the Philips Sonicare Flex Care Platinum Connected Toothbrush. So the patients download an app. It summarizes their brushing over the past 30 days and it can email it to their dentists or dental professionals if they choose to. It shows touch-up areas that they might be missing, focus areas, it helps them set goals, and it will tell them when to change their toothbrush head. So per the ADA, these are the two main CDT codes for teledentistry. These were actually introduced in January of 2018. It's synchronous D9995, which is that real-time live video encounter, and asynchronous D9996, which is the store and forward of information. Both of these are reported in addition to other procedures like diagnostic codes that are delivered to the patient on that date of service. I'll get into more specifics later during the implementation because I know there's always questions about billing, but I more so just want to show that these are not specific services. It doesn't change your scope of practice. It's just a reporting of the methodology. So our current goals and responsibilities in the current environment, we have to both preserve PPE while at the same time use more than we ever have in the history of dentistry. And as you can see from this photo, which I added mostly for comic relief, but it looks like someone actually did engineer this bubble for their office. We're doing this so that we can help mitigate the spread of COVID-19. And then we're also doing what we can so that we can triage patients away from the emergency room, prioritize the patients that are the most emergent or are in urgent pain as we're slowly opening back up. And I had put this slide up when we were still under those orders that we could only offer emergency appointments, but in the event that we have to turn the dial back down, as our governor said, it's important to have this as a reference. What I like to note is what constitutes a dental emergency for a patient may differ from what we feel is an emergency. So it's good to have this list on hand. So this was an email that I received from the Health Policy Institute of the ADA in mid-April. Within this survey, the Health Policy Institute asked 19,000 dentists to consider what would happen if the non-urgent restrictions on practicing continued until the end of April, June, or August. 20 to 25% of those dentists said that by the end of June, they would need to find innovative ways to expand their patient base. So I say, what about teledentistry? Maybe you can attract new patients because suddenly someone's having pain, they don't have a dental home. You can be the one to offer them that first step. This may not necessarily be a huge financial gain, as you can only do so much on the phone. We obviously can't replace crowns and implants and other revenue generating procedures, but something like teledentistry could plant the seed. You could invite new patients to your practice when you have more time and room, maybe in September. So this would be an initial investment. And as we'll discuss, you can get paid for teledentistry services, so it can definitely help. They were also asked, would they want to find innovative ways to lower their operating costs? And many did say that they would want to do that. We'll discuss this more too, but teledentistry may help decrease your overhead costs by using fewer PPE, fewer staff, and chair time. Another one was borrowing money to address financial shortfalls. So anyone that borrowed that payroll protector plan may be needing to find more work for their staff if you're not up to your business as usual. So getting your staff trained on teledentistry or asking them to help you set it up could definitely be a way to use that loan. And then it's unfortunate to see towards the right side of this graph that 46% of dentists reported they would not be able to sustain their practice if this continued until August. So that's unfortunate to see. Luckily, we are starting to open back up, but it's not quite the volume that we were used to. So there are many benefits of teledentistry, especially now when we're not wanting to overwhelm the emergency rooms. It's important to offer services that can help mitigate the spread and where we can effectively triage patients. The ADA's Health Policy Institute reported that in 2012, $1.6 billion were spent on dental-related emergency room visits, and that the majority of these could have been treated in a dental clinic and they didn't need to be in the ER. And that was before we had a pandemic. An article in the Journal of California Dental Association from 2018 states that receiving prior information can allow a dentist to reasonably predict treatment and accurately allocate staff, time, and materials for care. If you're asking every single urgent care patient that you speak to on the phone to come in, you may be using more PPE than you need, or you could be increasing the risk of exposure between your staff and your patients. Because like I said, what constitutes an emergency for a patient may not constitute one for us. So when we have precious chair time as we're trying to slowly open back up, it's important to really triage what needs to be seen and who could stay home for now. And then, like I said, that could help you decrease overhead costs as well. Teledentistry can also increase access to care. HRSA, or the Health Resources and Service Administration, reports that 59 million Americans are lacking basic dental care, and that's as of 2020. This could be from a lack of insurance, of cost of procedure, transportation or mobility issues, or as the ADA's Health Policy Institute reports, a shortage of providers. We have 6,319 areas of the country that are designated as professional shortage areas. I know Minnesota has a ton as well. The other thing is you could start new patients via a video conference call, and this could help reduce anxiety or the white coat syndrome. We dentists are already very scary to people, and with the amount of added PPE we'll be wearing, we're gonna look even scarier. So if you can imagine starting your first relationship with this kiddo in this picture via FaceTime, you would get a chance to build rapport and trust. He's at home on his mom's lap, he's comfortable, he's seeing how nice you are and you're smiling. Maybe his dog's on his lap, so he's nice and calm. Next time when he comes in to see you, he's gonna be excited to meet you and see you in real life because he already knows how nice you are. Along with that, maybe this mom's chief complaint was that her kid has 2 rows of teeth on the bottom and she's really concerned because we've all had that come in, and we know that's a variation of normal. We look and we say, don't worry, maybe we'll need to extract those baby teeth, but for now, let's monitor. We don't need to do that during the pandemic. So this mom took PTO off, took her kid out of school to bring them into your office for us to say, don't worry about it. If we could do something like that, that's easy to see over video chat, it would be really convenient for this family. So teledentistry will never take away from direct patient care. We're always going to need to see patients in real life. We can't virtually clean their teeth or fill their cavities, but this can absolutely enhance how this is done. It can add value for the patients, it can provide more convenience, and I'll go through even more examples of how. In 2011, a research article said teledental services are among the Institute of Medicine and National Research Council's top recommendations for improving access to care for vulnerable populations. Research has shown that patients already use web-based devices for health needs because of the ease of use and convenience. And according to the American Teledentistry Association, recent studies on the use of telehealth services have shown that 70% of patients are comfortable communicating with their healthcare providers via text, email, video, in lieu of seeing them in person. And 76% of patients prioritize the access of care over the needs for face-to-face interactions with their healthcare providers. So patient attitudes surrounding a new service are important to consider. In a time of Amazon Prime and Instacart, grocery delivery, Netflix, the general public is used to and sometimes even expects more convenient options and services. Of course, there are challenges. At the University of Minnesota, we work with an interpretation service. I would be interested in exploring if we could conference call in those interpreters, if we were doing a Zoom video. Depending on the interpretation service you use, you'll have to figure that out. During the crisis, you may have a family member interpret for the patient, but anything that requires informed consent does need a trained interpreter. Teledentistry also does require adequate broadband support, which I know a lot of rural communities don't have great broadband out there. Patients also may not own computers or smartphones. Depending on which method you use, there could be a security issue, and we'll talk a little bit more about that. And then technical literacy. So you may want to consider having some kind of patient instruction or education for whichever tool you use, such as how do you download Zoom, make sure they download that ahead of time. I know the University of Michigan Dental School has a good document on that. And I will say I feel very tech literate because I've grown up with technology, but even during this crisis, it's been a bit of a learning curve to download Zoom and Google Hangout and WebEx and GoToMeeting, and there's so many different ones, and getting used to all of them can be a challenge. Teledentistry has already been implemented successfully in many environments in the US even before the crisis, and then many have popped up since the crisis started because people are very creative under pressure. And I just wanted to go through a couple of examples to show you how it is already working in a couple of different environments. So again, I'm not being paid by the teledentist to talk about this, but just to show you a rundown of how an appointment works when I do take a call through this service. So I receive an alert on my phone or my computer that a patient has entered the waiting room. I log on to the portal to review their chief complaint and their medical history and whether or not they're covered by a third-party payer. And then I initiate the video call on the VC Messenger, which is a software that's available to the public. Everything in this portal is secure, encrypted, HIPAA compliant, and as long as I'm not in public or near my family, it's secure. We then have a discussion on what is bothering them, such as if they have a broken tooth or if they have some swelling. I can then e-prescribe any necessary medications to the pharmacy of their choice, or I could direct them to the emergency room if they have swelling that I think is more emergent. I could also call in a customer service representative who then connects them to a dentist in their area. Or if it's more non-urgent, I can say, look up a provider in your insurance network. An asynchronous example is the Toothpick app, which is the other company I work for, and I'm not being paid by to talk about them. In this, the patients pay a fee for this service. The Oral Eye or Toothpick is partnered with Sonicare, so that's how they do their marketing. Patients are told that a dentist will respond to them within 24 hours of requesting this report. I receive an email stating that a patient has requested this report via a patient portal. It's, again, a secure, encrypted, HIPAA-compliant form. I log in to review their medical history, their chief complaint, patient photos, because Toothpick asks them to take 6 photos and they give them details on how to do that. I then tag areas that I see as a concern, which you can see in this photo. That's what the tag looks like. I give an assessment. It's not necessarily a diagnosis. In this case, that tag, the doctor wanted to point out mild gingival recession. So this may or may not have been the patient's chief complaint, but we tag anything that we see in these photos so that we can help educate the patients. We then give palliative or educational advice and then advise the patients to follow up with the dentist and tell them how urgently they need to go. There are many dental schools across the country that are already offering teledentistry. I was able to speak to Western University of Health Sciences Dean for Community Partnerships and Access to Care, which was fun because that was actually where I got my dental school training. What they're doing is they're using, or in 2018, they started using a platform called Dentacom, which is a HIPAA compliant web-based triage portal. It was actually created by one of their students, which is neat. With this, they use it in their school-based oral health outreach program. And they, in those schools, are training nurses, parents, or other school administrators how to use this portal. So when they're doing screenings, for instance, a kid comes into the nurse's office complaining of tooth pain, the nurse can go in and fill out the report, which then gets sent to a clinician at Western U. And then the clinician completes an assessment and then suggests an appointment either at their school-based healthcare center or with a pediatric dentist or whoever they deem necessary. In their outreach program, they use this hub and spoke model. So the hub is it's that school-based oral health care center. The spoke is our mobile clinics that are out in the district. The students are with an attending and they're gathering data into Axiom, and then to show the students how the teledentistry model is used, it gets sent to a faculty at another site. That clinical faculty evaluates the information, diagnoses, and then directs care back to the students or to the assistants. It might just be prevention. They say, go ahead and place some fluoride. We'll see them in 6 months or what they deem necessary. Or in some cases, they may say, go ahead and place an interim therapeutic restoration. And if you're not familiar with that, it's essentially just a temporary restoration to help pause the caries where it's at. So they might just do some spoon excavation, place a glass ionomer, and then reappoint that child back into the school-based oral health clinics or refer to a specialist. Some other schools in the country, in response to the COVID crisis, the University of North Carolina created a virtual helpline where they conduct video conference calls and then connect patients to specialists. At our very own U of M pediatric department, Dr. Sarvis explained to me they're using a mix of synchronous and asynchronous technology. So the patients will call with their chief complaint, the residents gather information and their health history. The patients are then directed to a HIPAA-compliant web-based portal where they enter more information. They're asked to take pictures, and I'll show how that looks later. And then the attending and the residents go through those pictures, go through the information, determine if they want to bring the patient in, or maybe they just initiate a Zoom call, and then they appoint from there. Many of you on this call are probably familiar with Children's Dental Services. If you're not, it's a large nonprofit in Minnesota that provides services in school-based oral health clinics, Head Start centers, and in rural locations. They received a telehealth grant program in 2016 to 2020. They adopted the virtual dental home model, which I'll show a visual of in the next slide. This model was created by Dr. Glassman at the University of the Pacific in California. It's been used at that school successfully for 6 years. This model sends allied dental professionals like hygienists and dental therapists out into the community, and they treat patients at the top of their scope. They then receive remote provision of care from dentists. The benefits of this model is the necessary travel for patients is reduced, and they can decrease the number of appointments needed to complete their care. It can also increase the number of patients that can be evaluated by a dentist. So this is what that looks like. Essentially, it's hygienists and DTs gathering data, sending it through Open Dental, so the doctor can synchronously or asynchronously look at the images, discuss with the team member, or even on the phone can chat with the patient right then and there. The dentist then directs care as needed. They either ask the advanced dental therapist or DT to work at the top of their scope, place a filling, or complete the periodic exam and charge that out based on the findings that they see. Or the doctor can request a visit back with them if it seems to be more of a complex case. In Minnesota, we have collaborative agreements where dental therapists and dental hygienists can perform services within their scope before the dentist is required to complete the exam. So with that, they don't have to have teledentistry and they can still see patients. The patients are then directed back to the dentist for a comprehensive exam. But if we were to add the teledentistry component, we could decrease even more the amount of times a patient needs to travel. We could help with early intervention, which could help avoid costly procedures down the line. And it can help bring dentistry to patients that might not otherwise be able to easily get to a dentist. At this point, you might be saying, this is great, I'm sold. Tell me how I can offer this to my patients. So I'll tell you how. First, you must determine if your practice wants to offer this in the short term, or if you're looking to implement this more in the long term. Maybe both. Maybe you just want to quickly get it started and then figure out a long-term solution later. You probably heard, and I'll show proof of this too, but the federal regulating body put out a statement that they will not penalize healthcare providers on any HIPAA compliance issues that are offering telemedicine or telehealth in good faith. Many insurance companies are also offering reimbursement for teledentistry services. Some are only temporary and they're only offering it during the crisis, but I imagine that many will continue beyond this. There are some insurance companies that are even reimbursing right now for telephone calls alone. And I know before I did not say that because the synchronous generally needs to have a visual component, but there are some that have loosened that even more. And then you need to ask, are you going to start offering these services for existing patients only? Do you want to offer it to new patients? Remember, there will be patients out there looking for a dentist that may not have a dental home. So you could be the hero in their time of need so that they don't end up in the emergency room. If you do want this to be a long-term offering, You want to determine how you're going to include this into your normal office workflow. Maybe you're wanting to use this as a means to increase preventive measures, like asking your hygienist to call patients and have discussions and offer OHI, or oral health instructions. Maybe you already have a satellite clinic, or you want to help increase dental care options for underserved communities, like partnering with a dental therapist in a collaborative agreement and treating even more patients utilizing teledentistry services. A lot of what I've said up to this point is in relation to Minnesota's laws. If you're from out of Minnesota, make sure to check your state regulations and reimbursement policies. The Center for Connected Health Policy can help with that, or you could call your Board of Dentistry, but this is showing that website. It's a really nice one. I'm unsure of international regulations. I know France and South Africa, for a fact, are allowing teledentistry, but again, just call your Board of Dentistry. Next, you need to determine how you're going to offer these services. Your options include using an optimized teledentistry system, which would be considered an all-in-one HIPAA-compliant software system. These are already on the market. They're patient-tested services, so they may be more convenient. They may have staff training available from the company, and they will probably be a better long-term option because the HIPAA regulations are only loosened during this crisis. The downside is that most of those have a fee for the service. Many of them do have free trials or discounts at the moment, but when we're in a struggling economy, I know that's a tough decision to add more cost. So if you're wanting to get set up really quickly, and just for the short term, you might consider using a combination of already available tools that are free or low cost. We'll run through what those are. Just know that they may have security risks associated with them. But the main benefit is that patients may already be familiar with these apps or systems. And there's also a lot of options. So an all-in-one system, this is that visual representation showing that it will have an area where patients can fill out registration forms and their informed consent. You can complete your messaging or your video within the system. They may have scheduling software included. It's all encrypted. And then they may also have marketing materials to help inform your patients that you're offering these services. These are some options for optimized services. This is not an exhaustive list, and I'm not here to sell you on any of these or discuss any fees, so I'll let you do your own research. I more so just want to show you that there are quite a few options available if you choose to go this route. And some, but not all of them, may integrate with the electronic dental record that you already have. If you're more interested in starting with tools that you already have access to, the ADA states on their website that you can use FaceTime, Facebook Messenger, Skype, VC, Zoom, WebEx. If you don't have remote access to your electronic dental record software, you may need to look into a scheduling application such as Calendly or Doodle. What's nice about these is they can integrate with Zoom. So you put down all of your available times for a video call, and then an email is sent to the patient. They can choose what time works for them. Then you both receive a link to a Zoom room at that scheduled time. Zoom also has an option for healthcare, but it is a paid service. The free service will kick you off after 40 minutes. I think that might be changing, but if you're looking to have a longer conversation, just be aware of that. Google Voice is a nice option if you don't want your patients to have your personal cell phone number. You can sign up for a new phone number, which is free, and you can call and text via that website. Most of those free services are not HIPAA compliant. If you are interested in Google Voice, there's Google G Suite, but you have to pay for that. If you're conducting teledentistry from home and you decide that you want to see new patients or any patients that you haven't seen in over a year, you are going to need an updated medical history, and you want to have a way to get those forms to you. So are you asking the patients to email them to you, fax them to your office? Do you have a secure portal on your website? You'll want to consider a new informed consent as well, and I'll describe what that looks like. If you do have access to your EDR, it might be easy to schedule a follow-up visit. If you don't, maybe you're using Calendly. Again, if you have access to your software, you can bill the patient or bill their insurance. If you don't, you could use the Square app to accept credit card payments. And then for documentation, again, if you have that EDR at home, great. You can enter all the notes into your chart, but if you don't, you could write it down on paper. You just have to be cautious of where you're going to store that. Can you lock it up at home, etc. So if you do decide to use these available and free tools, a word of caution, you must tell patient that any video call you are using may not be secure. And if the patient understands that risk, you can proceed with the virtual visit. Patient's email may not be secure. I know that my Google Gmail saves my password. So on my shared computer, I want to make sure that my family is not able to see that. Certain emails may also not be encrypted. So if patients are sending photos or sensitive information with medical history, you want to be careful with that. iPhone messages, if you're texting via phone or Facebook Messenger, those can be stored in the cloud. So even if you delete it off of your phone, it may still be accessible. And the ADA says if you are going to use emails and text, you want to make sure that you have a written analysis for your office and you're implementing reasonable and appropriate safeguards. You also want to make sure that you are completing the same standard of care as in-person appointments. With that, you want to be cautious with your diagnosis. You can't definitively diagnose everything without an X-ray. So you really want to document and notate that your assessment is most likely to be whatever you determine. And then make sure you are confirming patient identity and date of birth at the start of a call, especially if it's a new patient. And lastly, I put the little banner at the bottom. We're using Zoom right now. This is from Zoom. There's a little security tab. So if you are using Zoom or Zoom Healthcare, once the patient is in, you want to lock the meeting. And just know that if you do lock it and the patient loses their connection or ends the call for some reason, they can't get back in on that Zoom link unless you unlock it. But that's one way to help secure your room. So the protocol to offer this in your clinic is you want to inform patients that you have teledentistry available, collect informed consent forms and updated medical history, have the patient send you photos if that's what you would like, and then schedule a virtual visit or phone call, plan for follow-up, put them on a wait list or refer them out, and then document everything and bill the patients or their insurance. And if they don't have insurance, you might want to be collecting payment at the beginning of the phone call. I have a few slides coming up that are a little wordy, but this is, I will have these on my handout, this one in particular. I more so just want to give you examples of words or wording that you can use. So this is from the Virginia Health Catalyst. This is an example of how you can advertise to your patients that you are offering teledentistry and a rundown of what that would look like. You are wanting to get a new informed consent. Again, this is on my handout, but this is basically saying that I understand that I'm being asked to send photos, that I may have to be responsible financially if my insurance ends up not covering this service. I understand I need to go to the ER if I have swelling. It would be great if you could have all of your patients sign an informed consent, but in some cases, verbal might be all that's possible. So you might want to be reading your informed consent over the phone and then get that verbal consent and document that you got that. Also note you might want to have translated consents for other languages. And then I recommend any new informed consent, especially if you're a business owner, discussing it with your lawyer. If you're concerned, you could also check with your malpractice insurance carrier about teledentistry. I, in the beginning of all of this, went on my malpractice insurance website, and it just said you can offer teledentistry as long as you're following the ADA's guidelines. Some states also require that you record the video call that you have with patients. Minnesota doesn't, so just check your state requirements. Another wordy slide, this is ADA's informed consent sample language. This one is essentially saying, I understand that HIPAA compliance is loosened as long as we're not using something public facing like TikTok, Facebook Live, Twitch, I am okay with it, but there could still be a security issue. It's up to you what you want to include in your informed consent, but these are some samples for you. So this was the announcement that came out from the US Department of Human and Health Services from the Office of Civil Rights. I want to put this as proof that truly you are not going to get in trouble if you're acting in good faith. This was released on March 17th. And then that last paragraph is kind of the important one, that we are empowering medical providers to serve patients wherever they are. We especially are concerned about reaching those most at risk, including older persons and persons with disabilities. So not only are they loosening the regulations, they're asking you to do this. So next, if you're asking patients to send you photos, you want to make sure that they're quality. And so these are some examples of tips for the patients. You might want to ask them to use a flashlight or a headlamp, turn the flash on, or maybe take a photo near a natural light source. And then a safety reminder before you ask patients to stick their fingers in their mouth. Per CDC, you want to ask them to wash their hands, use hand sanitizer. After you wash your hands, don't touch any surfaces in between. Maybe you want to ask a family member or a quarantine buddy to help take those photos, like the photo on the right. If you want to use a self-timer, maybe sanitize the phone before you touch it, same with a flashlight. So again, this is in my handouts. I think this is a really nice guide for asking patients to give a series of photos. Our cell phones have really high quality cameras, so you can really get some diagnostic images if the patient is doing it correctly. So kind of going through, this guide is showing all the different shots you could ask for. It has nice descriptions here, like tip your head down as far as you can to get that mandible shot. Here, that top one, maybe you would ask the patient to retake it with a better light source rather than just that blue computer background light. But with this, you could send the whole document or just the images that you are looking for. So I think that's just a really nice resource. And then this is from the U of M. Dr. Sarvis gave me permission to share this. I thought this was a brilliant use of resources at home using spoons as photo retractors. So this was for the pediatric department. This could be used for adults also. You might just need some bigger spoons. That fifth one, that front-facing shot, is useful if you're looking for any facial swelling. And then if you've determined after your teledental call that the patient needs follow-up in the clinic, the idea is you're looking for fast, efficient, and effective appointments so that you can minimize exposure risk and the amount of people in your clinic at one time. You're wanting to have all the information, explanations, payments, and consent forms filled out or exchanged prior to the patient arriving at the dental office. And then once they're in, you're trying to minimize the exposure risk, create shorter appointments. Per the Minnesota Dental Association, this is just a part of that list. A lot has changed, but maybe you want to have the patient wait in the car, call when they arrive to the clinic, not have any siblings or friends, only caretakers or parents of minors. Maybe they just sign the informed consent and then leave to try to minimize that even more. The teledentistry call would have helped you determine what setup is needed, so hopefully that can go a little bit quicker. You're staggering appointment times, taking everything out of the waiting room, taking temperatures beforehand, and so on. So this is a visual representation of how teledentistry and follow-up care will or could look. So outside the office, again, you're doing through the patient portal, explanations, instructions, giving advice in OHI, filling out all that paperwork. You're doing pre and maybe post-visit care. I know that at the U of M, the oral surgery department is doing their post-ops via Zoom as well. And then once patients do come into the clinic, maybe your clinic is separated where one end is more of the highly modified operatories where you're doing aerosol producing and highest level of PPE. And the other side, so that there's less aerosol spread, is where you're doing more minimally invasive procedures. And maybe that's silver diamine fluoride, exams, interim therapeutic restorations, things that don't use the handpiece. So if you've gone through your teledental call and you've determined it's not urgent and you're trying to still triage that precious chair time that you have, what you'll want to do is place the patient on a wait list and then prioritize which ones you need to be seeing first. Give them palliative suggestions, discuss OHI, which actually does have a CDT code. Some insurances will reimburse for that, not all. So if you are charging, just make sure you tell the patient that there could be a fee. But you could also do nutrition counseling, tobacco cessation, and then consider prevention tools if you're having them wait, like prescribing Prevident. And then just be mindful that oral hygiene and oral care might not be people's priority right now. We're dealing with unemployment, childcare needs, illness of loved ones, civil unrest. So the patient, you might need to help provide them resources to a food bank, to mental health services. I saw on the news that the mental health hotline, the national line, had an 891% increase in calls. You also, if you are referring, make sure you know which specialists in your area are open. Are they open to everything? Are they only seeing emergency calls, etc.? And then this is also available in my handout. I'm not going to talk through all of it, but you may want to come up with a similar workflow for your office so that all of your staff can really understand how this new service is going to work. And this is also in my handouts because I know it's another wordy slide. You might want to take a photo of this, but I'll make that available. These are the billing codes, the CDT codes that the ADA lists as the ones you're going to most often be using in teledentistry. It's those diagnostic codes like screenings, limited exams, post-ops or reevaluations, case management, and then the teledentistry codes, just those two, the D9995, D9996. Those are the codes that are reported in addition to those up above. And then this is just a snippet of the ADA's COVID-19 coding and billing interim guidance. It has 7 pages of insurance companies listed. I just wanted to show you what this is looking like. The most recently updated one was from May 11th. It's essentially asking, they went through and asked each insurance provider if they are offering to reimburse for limited exams, post-ops, for the consultation with a patient's physician, and if they have any frequency limitations. Many of the insurance companies did loosen that, where normally they would have 1 to 3 visits were all that were allowed in 1 week. Some said they could have it every day if they wanted to. So that's been changing too. I know United Healthcare here, the one I have, says only until April 30th, but again, reference this, it's changing. You may even want to just call your insurance companies if you're questioning it. And this is from Delta Dental's website. This is just proof, again, that Delta in Minnesota is covering the limited exam code, the D0140. Health Partners is also reimbursing for both that and reevaluation. MA is also, Health Partners and Delta are also extending this to their MA and their commercial. I know Health Partners furloughed many of their employees in their claims departments, so I was told that reimbursements could be slower. It might be harder to get a hold of them. Delta didn't, so they might be easier to get a hold of, but many of the insurance companies said the easiest way to get a hold of them is via email right now. And then this is from the Minnesota Department of Health Services. This was before COVID-19, a list of all of the allowable codes that can be billed out via teledentistry. So many of these will correlate to the services that are provided by an allied health professional via that asynchronous or virtual dental home model, or synchronous, but it includes diagnostic codes, x-rays, etc. And then this is one thing to note: if you are an MA credentialed dentist, in order to receive reimbursement from MA insurers, you must first fill out this provider assurance statement. But FQHCs do not need to file to HRSA requesting an expanded service. And then this is proof that from the Minnesota Department of Human Services that telephone calls alone will be reimbursed for MA patients. I imagine this is because not all low-income patients have access to internet or smartphones. So they are loosening it to where you can charge a limited exam by just completing a limited exam over the phone. There just must be a documentation and talking about the medical necessity for that phone call. I was also told you can backdate any teledentistry or telephone calls that you've been providing back to March 17th when this first came out. And then if you're at a nonprofit, an FQHC, or a higher education institute, this was a grant program I wanted to make everyone aware of. The FCC, as part of the CARES Act, is offering to provide immediate support to fully fund telecommunication services and devices necessary for providing telehealth services. I checked and this was still up on Friday, May 29th. So go get that money if you are interested. And then documentation requirements. This is, again, from the Minnesota Department of Human Services. It's almost identical to what the ADA has listed, and you really just want to make sure you're following this so that you are going to get reimbursed. What they're requiring in your patient note is the type of service that you provided, the time it began and the time it ended, a description of the medical necessity, essentially, the mode of transmission, whether that was synchronous, asynchronous, and then the location of the originating and the distant site. So maybe just say provider's home address and listed on file. And then you might want to consider adding any screening questions that you've been asking for COVID-19 and that statement I made earlier about this is not a definitive diagnosis until we see the patient in person. We're facing a new normal in dentistry. As we're opening back up, some patients might be scared to come into the dentist. We're already kind of turning that dial back on, but our U of M president had stated it's likely that our post-COVID-19 lives will begin more as a sunrise rather than an abrupt flip of a light switch. How dentistry could look moving forward with teledentistry integrated is maybe you have an extra operatory that is dedicated completely to teledentistry, or operatory, it could just be a consult room. Maybe you have patients scheduled into your scheduling software, just a column of teledentistry calls. And maybe you're offering to new patients, do you want to come into the office for your first visit, or do you want to start out with a video call with the dentist and get a little more comfortable before you come in? So maybe you have an assistant work similarly to what they would be doing with the patient in the office, where they are initiating that video phone call, they're taking notes, and then they're coming to grab you to say this patient is ready. Maybe you already have an existing satellite clinic, or you're wanting to expand into long-term healthcare facilities, into group homes, schools, rural sites to help increase access to care. And as I mentioned earlier, this could be a good option for dental phobic, pediatric, and even adult patients. We could use a video call to explain to the patient the safety measures that we're going to be having in place in our office and help assure them that coming back to the dentist is safe, and explaining that we don't want their dental health to suffer if they continue to wait before they come in. And then according to the Minnesota Dental Association, during the crisis, we are allowed to mail out clear aligners, dentures for high-risk patients, night guards, mouth guards. Anything that can be virtual maybe should be at this point, again, while we're triaging and trying to fill that precious chair time with the patients that we already have at the top of that wait list. So many of these appointments are so quick anyway. If they, those clear aligners, they snap right on, you take a quick look, great, see you next month. So maybe you're mailing it to them and having a video call and checking and making sure, and then deciding if they need to come into the office at that point or just wait till next month. And unfortunately, this might not be isolated. I hope there's not another pandemic or a spike, but it's possible this could happen again, or that dial could turn back down. So having this tool available is going to be really helpful. Also in Minnesota, if we have a blizzard, in other areas, maybe there's hurricanes, having something like this available so that your office doesn't have to completely shut down would be great. I just wanted to give a quick sample virtual consult, what this could look like in your office. This is a friend of mine, Gretchen, so this is not actually her information. I Googled all these images, but just for the sake of practice, we created this. So I used Zoom and I used my share screen mode. So let's just say that Gretchen came in the beginning of March as a limited exam, saying she was wondering if she needed to get her wisdom teeth out because they on and off hurt sometimes, but not that day. So we took a pano, we had a little extra time, and we said, hey, do you want to start getting some data gathering? Do you want to take x-rays so we can get you back in for a cleaning? And she said, yes, I really would love that. I want to get a cleaning. We didn't have time to do that day, but we figured we would get a start. We had scheduled her for the end of March, but the crisis happened. We had to cancel her visit. So she calls me in April and she said, oh my gosh, my lower left molar is starting to hurt. So I pulled up all of her images from my electronic dental record because I have access to that at home. And we discussed that I can see a crack. I see that there's some flattened cusps. It looks like maybe she's clenching and grinding. I can see the margination on her amalgam. So I said, most likely this tooth is going to need a crown. For now, while you're at home, maybe you can go get some Sensodyne, use lukewarm water, chew more on the right side, maybe go get an over-the-counter night guard between now and when we can get you back in. Because she says it just hurts sometimes when she bites down, not all the time. So she's not an urgent patient, but I said, if it starts to hurt more, give us a call immediately. She was so appreciative. She's never seen her images up close and personal like that. She was interested in that crown, so I asked if she wanted my front desk to give her a financial breakdown with her insurance coverage. She said that sounds great. While I had her on the phone, we were looking at her bite wings. I showed her that she had some calculus, so we talked about how she could increase her brushing and flossing while she's at home more. So this was a really, it created a lot of value for this patient. We're almost done here. This is, I thought, an interesting study from the Health Policy Institute in 2015. It was a study of almost 15,000 Americans. It was showing that 77% of adults say that they plan to visit the dentist within the next year, and only 37% of adults actually visited the dentist that year. And they asked why they didn't come in. So cost was the main reason. Dentistry will continue to be expensive for some, but teledentistry could help reduce those costs. You're still going to need x-rays when they come in, but this could be kind of a cheaper baby step to help with prevention and education. Almost a quarter of Americans don't come in because they're scared of us. So how can we change this? If you're thinking of those innovative ways to expand your patient base, how great if we could use teledentistry to take the time and ask, when you do come in to visit us, how can we make your experience better? Are you scared of the sound of the drill? Maybe we just schedule you right into that quiet room where we can shut the door and make it more pleasant for you. You can take the time to build that trust and rapport and show how nice and caring and compassionate you are from the comfort of yours and the patient's own home. And then also listed was inconvenient location or time. So with teledentistry, maybe every Tuesday evening, you're opening your schedule for teledental calls, or maybe on the weekends, Saturday mornings, you're doing teledental calls to get that first step started. And then I thought this was interesting, showing how Minnesota compared to the national percentages. We are 6% more anxious than the US average. I don't know if that's weather related because of our icy roads or why we were more scared. But we also had a lot harder time finding a dentist, 28% versus 15% in the national average. And we do have a lot of rural areas. We have a lot of uninsured patients. I looked up on the Minnesota Department of Health that 28% of Minnesotans don't have dental insurance. So how can we use our services to increase that access to care? I would say teledentistry would be a good start. In summary, teledentistry is a cutting-edge means of delivering care, especially during our current crisis. Synchronous or asynchronous modalities can be quickly and easily utilized. Each office must decide if and how they're going to implement long-term following state legislature and ADA guidance. And dentistry is facing a new normal. Teledentistry is part of the future. Whether or not you decide to incorporate teledentistry into your practice, your patients might start asking about it because it's going to become more widespread. It already exists and it's going to continue to grow. It's not going to go away. So we really need to find the opportunity from the tragedy of what's going on right now. These are my references. And I wanted to put my email up here. If you have any questions that I don't answer today, or if you have to get out of here, please, I'm always a reference for you. I also want to just highlight, these have been my coworkers as I've been home, so I want to give them some attention. So let's see, let's look at the chat box here.
I just want to say before we get to that, Dr. Hastings, this has been fantastic. And I was paying attention to the 28% who said they were afraid of a dentist. And I thought, if they would just meet you, everything would be fine. So thank you.